Okay, so for years, I genuinely thought dandruff was just, a bad hair day problem, maybe a bit of dry skin.
Hmm.
And like so many of us, I kept hoping there was some elusive, like permanent fix out there. That one magic shampoo that would just make it all disappear forever.
Oh, yeah. That search is incredibly common.
Right. Who hasn't felt that frustration digging through products, convinced the next one is going to be the one?
It really is. Those flakes appear, and our first instinct is usually, well, find a quick, superficial solution.
Absolutely. But the sources you shared for this deep dive, they go way, way beyond just scratching the surface. And yeah, pun absolutely intended there.
Uh-huh.
Our mission today is really to pull out the most important insights, arming you with a completely new understanding and, even better, a truly actionable plan for like long-term control.
Right.
Because here's the first big insight that completely shifted my perspective, honestly.
What's fascinating here is how the clinical consensus views dandruff.
Huh.
It isn't really a standalone condition of simple dry skin.
Mhm.
It's actually the mildest manifestation of a chronic inflammatory skin disorder called seborrheic dermatitis, or SD.
Wow. Okay.
And this fundamental understanding, it's absolutely critical for lasting relief because it completely reframes your entire approach to managing it.
That's a huge aha moment right there. Seriously. So, if I've been thinking about this wrong all these years, what's the single biggest shift in mindset I need to make right now based on that?
Well, the biggest shift is recognizing that dandruff isn't just a temporary nuisance you can wash away. It's a spectrum condition.
A spectrum.
Yeah. And even in its mildest form, it involves an underlying inflammatory process. So, you're not just treating flakes, you're managing a dermatological condition.
Got it. Okay. So let's define the spectrum then. Where does typical dandruff fall, and how does it relate to its more serious cousin, seborrheic dermatitis?
Okay, so dandruff, as described in the sources, it's the milder end. The non-inflammatory end really stays on the scalp, presenting as light, white to yellowish, kind of dispersed flakes.
Yeah.
You might have no itching, or maybe just very mild itching. And crucially, there's no visible redness or obvious inflammation.
Okay.
Though if you looked at it microscopically, you might actually see subtle signs. Little hints of immune cells suggesting a very low level of inflammation.
Interesting. And then when it moves beyond that mild stage, we get into full-blown seborrheic dermatitis. What does that look like?
Precisely. SD involves more than just flaking and itching. You'll actually see visible inflammation, noticeable redness, and more significant scaling.
Okay.
And unlike dandruff, which tends to stay on the scalp, SD can affect any seborrheic area or, oil-rich areas.
Like where specifically?
Think about the sides of your nose, your eyebrows, eyelids, ears, sometimes the chest, armpits, even the groin area. And on a cellular level, there's a much greater presence of those inflammatory cells.
So understanding this continuous scale from mild dandruff to more severe SD, that explains why just using a regular moisturizing shampoo often falls short. You really need a targeted, maybe even medical strategy. The goal shifts from just washing away flakes to actually managing an underlying condition. That makes perfect sense.
Right.
But how do we distinguish it from other conditions that might look similar? Because I can imagine getting that wrong.
Yeah, accurate diagnosis is vital. You don't want to waste time on ineffective treatments. For example, simple dry skin is often confused with dandruff.
Okay, how's that different?
Well, the flakes from dry skin are typically smaller, whiter, maybe more transparent. And you'll usually notice dry skin elsewhere on your body too, right?
Mm-hmm.
And it often gets worse in cold, dry weather. Dandruff flakes, by contrast, are generally larger, can feel a bit oilier, and are white or maybe yellowish.
Okay, that's a good distinction. What else?
And then there's contact dermatitis. That's basically an allergic reaction or irritation from touching something like an ingredient in a new hair product or dye.
Ah, okay.
With that, the symptoms pop up after you use the product and clear up once you stop using the culprit. Pretty straightforward.
Got it.
And it's important to remember other skin disorders can mimic it too. Psoriasis, for instance, often presents with thicker, kind of silvery scales and more defined red patches.
Right.
Eczema and rosacea can also affect the scalp and face sometimes. So really, a dermatologist is essential to distinguish these conditions and make sure you get the right treatment plan.
Okay, with that clarity, the natural next question is,
Yeah.
why does this happen? Why do some people get it and not others? Our sources really emphasize it's not a single cause, but this complex interplay of three core factors.
Yes, it's often described as a triad of pathophysiology, sort of three key elements interacting.
Okay, here's where it gets really interesting for me. The first factor is the role of Malassezia yeast. Now, most of us have these, right? These oil-loving fungi living harmlessly on our skin, especially in oily areas. But it's not just the yeast being there. It's what it does.
Indeed. These specific yeasts, primarily Malassezia globosa and Malassezia restricta, they essentially feed on the oil, the sebum, on your scalp. They use enzymes, lipases, to break down the fats, the triglycerides, in the sebum. And in that process, they release byproducts.
Byproducts like what?
Like a specific unsaturated fatty acid called oleic acid.
Yeah.
Now, for susceptible individuals, this oleic acid penetrates the skin barrier.
And that causes the problem.
It triggers inflammation, yeah. And it causes your skin cells to grow and shed way too quickly, hyperproliferation. This rapid turnover creates those clumps of cells we see as visible flakes.
Wow.
And the fact that antifungal treatments work so well strongly supports the yeast's central role in this whole process.
That's a really clear explanation. So the yeast uses the scalp oil as food, which brings us neatly to the second factor, sebum itself, the oil.
Right.
It doesn't cause dandruff directly, but it's the essential nutrient source for that Malassezia yeast.
Exactly. It's the fuel.
Which perfectly explains why dandruff and SD affect oily areas. And you mentioned this earlier, it also sheds light on why it's often more common and severe in males.
Because of hormones, right. Yeah, androgen hormones influence our sebaceous glands, the oil glands. So that connection makes sense.
And it's not just how much oil, but maybe the type of oil, too.
That's also fascinating, yes. It might not just be the quantity of sebum, but potentially its specific composition. Certain types of fats or other components in your sebum might create a more favorable environment for the yeast, or they might directly weaken the skin barrier somehow.
Okay, complex stuff. Which brings us to the third crucial factor, individual host susceptibility. Because if Malassezia and sebum are almost universally present on adult scalps, why do only about, 50% of people actually get dandruff?
Right, that's the key question. The main difference seems to be an individual's unique inflammatory response.
How so?
Instead of just tolerating Malassezia as a normal part of their skin's ecosystem, some individuals' immune systems kind of overreact. They mount a disproportionate inflammatory response. And this is powerfully demonstrated by looking at people with compromised immune systems, like those with HIV infection. The prevalence and severity of SD are dramatically higher in that group, affecting anywhere from 30% to over 80% of patients.
Wow. So it's less about fighting an external invader and more about balancing our own body's reaction to something that's usually harmless, like an internal balance thing.
Exactly. That's the core insight, I think. It's about the interaction. And then there's the skin's epidermal barrier function itself.
The skin barrier.
Yeah. If your skin's protective barrier is already weak or damaged for some reason, irritants like that oleic acid we talked about can penetrate much more easily.
Ah, okay.
And that just kicks off the inflammatory cascade and creates this vicious cycle of irritation, inflammation, and more flaking, which can further weaken the barrier.
Makes sense. And finally, we have these predisposing factors or triggers, things that can make it worse.
Right. Things like psychological stress and fatigue, those are big ones. Seasonal changes, especially cold, dry winters, often trigger flare-ups.
I've definitely noticed that winter thing.
Yeah, it's common. And even certain neurological conditions like Parkinson's or epilepsy and psychiatric conditions like depression seem to be linked with more severe or frequent SD.
So putting it all together.
If we connect this to the bigger picture, this triad, the yeast, the sebum, and your individual susceptibility explains why dandruff isn't some simple infection you can just cure and be done with.
Right.
Instead, it's more like a dysfunctional interaction between your unique biology and a normal inhabitant of your skin. So the goal really shifts from trying to eradicate something which isn't feasible to restoring a healthy equilibrium.
That really changes how I'll look at my scalp. Seriously.
Yeah.
And that leads us to a really critical point you brought up, the fallacy of a permanent cure. Your sources are crystal clear on this. A one-time permanent cure for dandruff or seborrheic dermatitis is just not currently possible.
That's right. The underlying factors, your genetic predisposition, the fact that Malassezia is always going to be there, your continuous sebum production, you can't eliminate those. So any treatment that you stop, well, eventually the condition is likely to recur. It's just the nature of it.
So what does this all mean for you listening? It means we need to ditch the idea of a one-and-done cure and instead really embrace a management mindset.
Exactly.
Our sources compare it to other chronic conditions like asthma or hypertension. Success isn't about eradicating the disease entirely. It's about consistent, proactive management that keeps symptoms under control. And this management mindset is key, I think, to avoiding that cycle of frustration so many people experience, trying one thing after another.
It truly is. Once you accept it as something to manage, like you would manage blood pressure or a seasonal allergy, you empower yourself to control it, rather than constantly seeking that mythical permanent cure. The objectives really become about controlling the acute symptoms, the flaking, itching, redness, achieving long periods where things are clear, and having a plan for when flare-ups happen.
Okay. With that clarity, let's move from understanding the what and why to the all-important how. Specifically, what tools do we now have in our arsenal against flakes? For most people with, say, mild to moderate conditions, over-the-counter or OTC, medicated shampoos are the first line of defense, right?
Absolutely. These are really the cornerstone of treatment because they contain active ingredients specifically designed to target those underlying causes we just discussed.
Okay, let's quickly run through those key active ingredients and how they work. First up, the antifungals. Pyrithione zinc, or ZPT, that one's super common.
Very common. You see it in Head, Shoulders, and many others. It works by basically messing with the yeast's metabolism. It disrupts key processes the yeast needs to grow.
So it slows the yeast down.
It slows it down, yeah. It's fungistatic, slows growth, and that helps normalize your skin cell production too.
Okay. Then there's selenium sulfide.
Right. This one has a powerful dual action. It's a potent antifungal, but it's also cytostatic, meaning it slows down that rapid skin cell turnover directly.
Ah, two birds with one stone.
Kind of, yeah. You'll find it in products like Selsun Blue, very effective. Just a quick heads up, it can sometimes discolor light or chemically treated hair, so that's something to be aware of.
A good tip. And finally, ketoconazole 1%.
Yes, ketoconazole is a broad-spectrum antifungal. It works by inhibiting the synthesis of something called ergosterol, which is vital for the fungal cell membrane, basically, its outer wall. Without it, the fungal cell can't survive.
So it actually kills the yeast?
It can, yes. It's considered fungicidal in that sense. Nizoral AD is a common example you can get over the counter. Highly effective.
Okay, antifungals make sense. What else is in these shampoos?
Well, then you have the keratolytics. You can think of these as scale lifters, like salicylic acid.
Ah, I know that one from Acne products.
Exactly, same principle. It helps soften keratin, the protein in the outer layer of skin, making it easier to loosen and wash away those built-up dead skin cells. This is particularly useful if you have significant scaling or thick flakes. Neutrogena T-Sal is a well-known one.
Got it. And the last category?
Cytostatic agents. The main one here is coal tar. This one directly counteracts that rapid skin cell growth, that hyperproliferation we talked about. It slows down the rate at which your skin cells reproduce and shed.
Okay, where would I find that?
Neutrogena T-Gel is a classic example. Just a quick note on coal tar. It does have a pretty distinct odor that some people don't love.
Right.
It can sometimes stain fabrics or lighter hair. And importantly, it makes your skin more sensitive to the sun photosensitivity. So using sun protection on your scalp if you're using it regularly is important.
Okay, good to know. So we have these different ingredients, which leads to a big question.
This is an important practical point for you listening. Should you stick religiously to one shampoo or should you rotate them?
Yeah, what's the thinking there?
Well, there are kind of two main schools of thought, and understanding them helps you personalize your therapy. The rotation strategy is widely advocated by dermatologists.
Why rotate?
The main reason is to prevent something called tachyphylaxis. That's basically where your skin gets used to a treatment over time and it becomes less effective.
Ah, like building up a tolerance.
Sort of, yeah. So the idea is you rotate between, say, 2 or 3 shampoos with different mechanisms of action. Maybe a ketoconazole one wash, then a salicylic acid the next, maybe selenium sulfide after that. The different approaches keep hitting the problem from different angles and hopefully prevent that tolerance from developing, maintaining long-term effectiveness.
That makes a lot of sense logically. What's the counter-argument then?
Well, then there's the consistency strategy, which is often promoted more by the manufacturers of specific shampoos.
Right.
They argue that this idea of shampoo tolerance might be a bit of a myth, or at least overstated. They suggest that perceived ineffectiveness is more often due to inconsistent use, not using it often enough, or not leaving it on long enough.
Or maybe washing it out too soon.
Exactly. Or washing away the active ingredients immediately afterwards with a regular shampoo or a heavy conditioner right on the scalp. So this approach champions consistent, frequent use of a single, well-formulated anti-dandruff shampoo may be paired with a compatible conditioner designed not to interfere.
Okay, so consistency versus rotation. What's the best approach for someone starting out?
Well, a sophisticated approach, kind of synthesizing the advice from the sources, might be this. Start with the consistency strategy. Pick one potent single agent, maybe ketoconazole 1% or selenium sulfide 1%, as they are very effective. Use it consistently as directed.
Oh, okay.
If that provides excellent and sustained control over weeks and months, great, stick with it. But if you find its effectiveness seems to wane over time, then you could transition to the rotation strategy, bringing in another shampoo with a different mechanism.
Ah, so start simple and add complexity only if needed.
Exactly. It lets you adapt your therapy based on your own personal biological response, rather than just following a rigid rule.
That sounds practical. And regardless of which strategy you use, the technique matters.
Oh, absolutely crucial. No matter what shampoo you choose, you need to massage it thoroughly into the scalp, not just the hair, and then leave it in place for 5 to 10 minutes before rinsing.
5 to 10 minutes, that seems like a long time in the shower.
It can feel like it, but that contact time is essential for the active ingredients to actually penetrate and work on the scalp and the yeast. Just washing it on and off quickly won't do much.
Okay, message received. And how often?
As for frequency, it really depends on your hair type and the severity of your dandruff. But a good starting point for many people is using the medicated shampoo 2 to 3 times per week. And again, always focus the application right onto the scalp itself.
Okay, that's clear for OTCs. But what if they aren't enough?
Right. If over-the-counter products haven't given you significant improvement after several weeks, say 4 to 8 weeks, of consistent, proper use, or if your case is severe right from the start, then it's time to move to second-line therapy. And that means a professional consultation is necessary.
So, seeing a doctor, and what can they offer?
They can prescribe stronger treatments. This includes higher potency antifungals, like ketoconazole 2% shampoo, which is prescription strength, or cyclopirox 1% shampoo, that's another antifungal that works slightly differently, inhibiting key enzymes the fungus needs.
Okay, stronger antifungals. What about the inflammation and itching?
For significant inflammation, redness, and itching, topical corticosteroids are often the mainstay. They work by suppressing your local immune response right there on the scalp.
How do you apply those?
They come in various forms suitable for the scalp solutions: lotions, gels, foams. Examples include things like fluocinolone, betamethasone, or, for very severe cases, clobetasol. They are very effective for knocking down acute flare-ups.
But there's a catch, right?
Yes, a crucial precaution here. While they work really well for short-term relief, they're definitely not meant for continuous long-term daily use. Because prolonged use can lead to side effects like skin thinning, atrophy, changes in pigmentation, or making tiny blood vessels visible. So they're great for getting a flare-up under control, but then you usually taper off or use them only intermittently under guidance.
Okay, important warning. Are there non-steroid options for inflammation?
Yes. There are topical calcineurin inhibitors. Examples are pimecrolimus cream or tacrolimus ointment. These are non-steroidal anti-inflammatory agents.
How do they work?
They work differently from steroids, blocking part of the inflammatory cascade further upstream. They can be quite effective for seborrheic dermatitis, especially on sensitive areas like the face, and they don't carry that risk of skin thinning like steroids do.
Sounds good. Why aren't they first choice then?
Well, they're typically considered second line, partly because they tend to be more expensive than many topical steroids, and they also carry what's called a black box warning from regulatory agencies.
A warning about what?
About a potential, though generally considered unproven in typical use, long-term theoretical risk of skin cancer or lymphoma. So while effective, they're usually reserved for specific situations or when steroids aren't appropriate or sufficient. Always a discussion to have with your doctor.
Okay, so that covers topical prescriptions. What if even those don't work?
For a minority of patients, really, who have very severe, widespread, or treatment-resistant SD, then third-line therapies might be considered. This can include systemic treatments, meaning medications taken orally, and other advanced approaches.
Like taking antifungal pills.
Exactly. Oral antifungal medications can work throughout your body to reduce the Malassezia yeast levels systemically. Examples are drugs like itraconazole, fluconazole, or terbinafine.
How are those used?
Often they're prescribed in an initial, more intensive phase to get things under control, sometimes called an induction phase, maybe for a few weeks, then potentially followed by a lower dose or less frequent maintenance regimen to keep things suppressed long-term.
Are there risks with taking those?
Yes, there's an important caveat here. Oral ketoconazole, which used to be used, is rarely prescribed now because it carries a higher risk of liver damage compared to the others, and relapse rates after stopping it were also quite high.
Okay, so avoid oral ketoconazole. What about the others?
All oral antifungals carry potential risks, like gastrointestinal upset, and, importantly, they can affect liver function.
Yeah.
So if you're on them long-term, periodic blood tests to monitor your liver might be necessary. These definitely must always be taken under strict physician supervision.
Makes sense. Anything else besides antifungals?
Other systemic agents are sometimes used in very rare severe cases. Isotretinoin, you might know it as Accutane for acne, is a powerful sebum inhibitor. It dramatically reduces oil production.
But that sounds serious.
It is. It's reserved for the most severe recalcitrant cases because it has very significant potential side effects, including birth defects if taken during pregnancy, extreme dry skin, mood changes, and it requires very strict monitoring, including regular blood tests, really a last resort.
Okay, and one more advanced option.
And then there's phototherapy. This involves controlled exposure to specific wavelengths of ultraviolet light, typically UVB light.
Is that the canning bed?
Not exactly.
Yeah.
It's medically supervised and uses specific wavelengths. It can help control severe SD through its anti-inflammatory and immune-modulating effects on the skin. But it's not a quick fix. It usually requires multiple sessions per week for several weeks, done in a clinic or hospital setting.
Wow, okay. So quite a ladder of treatments available. But it's not just about the shampoos and pills, is it?
No, absolutely not. Beyond the direct medical treatments, adjunctive and lifestyle management play a truly crucial role. These aren't just passive suggestions. Think of them as active interventions that can actually modulate your host susceptibility factor we talked about earlier.
How so?
By improving your overall health and resilience, you can effectively raise your threshold for having flare-ups. It's about making your system less reactive.
Okay, like what kind of things? Diet, does that play a role?
It can. While there's no single specific dandruff diet proven to cure it, certain dietary modifications can certainly help manage inflammation and sebum. For instance, limiting sugar and refined carbohydrates.
Try those.
High intake can cause spikes in blood sugar and insulin, which can stimulate androgen release. Androgens, as we said, increase sebum production. Plus, those kinds of diets tend to be generally pro-inflammatory for many people.
Okay, limit the sugar in white bread. What should you eat more of?
Increasing healthy fats, especially omega-3 fatty acids, is beneficial. These are found in things like fatty fish salmon, mackerel, sardines, but also walnuts, flax seeds, chia seeds. Omega-3s are known to be anti-inflammatory, and they're critical for good skin barrier function and hydration.
Good fats. What about vitamins?
Ensuring you get adequate zinc and B vitamins is also important. Zinc is essential for immune function and skin integrity. B vitamins, particularly biotin, are also key for skin health. In fact, severe biotin deficiency can cause skin lesions that look a bit like SD.
Where do you get those?
Good sources include things like eggs, yogurt, nuts, seeds, leafy green vegetables, legumes.
Yeah.
A generally balanced whole foods diet usually covers these.
Okay, what about that idea I've heard about yeast in food, like bread or beer making fungal dandruff worse?
Ah, yes, the dietary yeast connection. It's debated. The theory is that consuming foods high in yeast, like bread, beer, wine, might somehow promote the growth of Malassezia on the skin, or perhaps trigger some kind of cross-reactivity.
Is there proof?
Honestly, robust scientific evidence directly linking dietary yeast intake to dandruff severity is pretty limited. However, some individuals do report that they notice an improvement when they consciously reduce their intake of these foods.
So maybe something to experiment with personally?
It could be. If you suspect a link, you could try reducing those foods for a while and see if it makes a difference for you. But it's not a universally recommended strategy based on current strong evidence.
Got it. Okay, beyond diet, what's another big lifestyle factor?
Stress management. This is a huge one. Stress is an incredibly potent and well-documented trigger for flare-ups of SD and many other inflammatory skin conditions.
How does stress do that?
Chronic stress can really disrupt your immune system's balance, making it more prone to inflammation. It can also directly increase scalp reactivity and possibly even affect sebum production or composition.
So chilling out is actually part of the treatment plan.
Absolutely. Finding effective stress reduction techniques that work for you is key. Things like mindfulness and meditation, regular physical exercise, which is a great stress reliever, ensuring you get adequate sleep. These aren't just nice to haves. They should be considered active components of your dandruff management plan.
Okay. What about just basic hygiene? Washing hair, brushing?
Proper general hygiene and scalp care are also vital, yeah. Finding the right washing frequency is key here.
More or less washing.
It's a balance. Washing too infrequently allows oil, dead skin cells, and yeast byproducts to build up, which can definitely make things worse. But washing too frequently, especially with harsh shampoos or scrubbing too aggressively, can strip away your scalp's protective oils and irritate the skin, potentially triggering more inflammation.
So find the sweet spot.
Exactly. That 2 to 3 times per week with a medicated shampoo is often a good starting point for many, but you might need to adjust based on your scalp's oiliness and how it responds. Regular gentle brushing can also help.
How does brushing help?
It can help gently exfoliate some of the loose flakes from the scalp surface and also potentially help distribute sebum down the hair shaft away from the scalp where the yeast feeds. Just be gentle, don't scrape the scalp.
And styling products, gels, hairsprays.
Limiting those can be helpful too. They can build up on the scalp, trap oil, and potentially irritate the skin. Especially try to avoid products that contain a lot of alcohol, which can be drying and irritating. And if you do use them, make sure you wash them out thoroughly when you shampoo.
Okay, good practical tips. Now let's tackle the big one. Home remedies. Apple cider vinegar, tea tree oil, coconut oil. People are always asking about these. I know I certainly tried a few back in the day.
Yes, the allure of a simple natural fix is strong.
So what's the verdict from our sources? Do they work?
Well, the clear consensus is this. No home remedy is FDA approved as a primary treatment for dandruff or seborrheic dermatitis. And frankly, none have shown the level of effectiveness in rigorous studies that you see with properly formulated medicated shampoos containing those active ingredients we discussed.
Okay.
They're best viewed as potentially complementary for very mild symptoms, maybe helping with itch or soothing, but not as a replacement for targeted therapy, especially for moderate to severe cases.
Are any of them better than others? Any science behind them?
Some do have a degree of scientific plausibility, yes. Tea tree oil, for example, is known to have antimicrobial and anti-inflammatory properties. There was a study using a 5% tea tree oil shampoo that did show some improvement in dandruff symptoms compared to placebo.
So tea tree oil might help a bit.
It might, but it needs to be used with caution. Pure tea tree oil can be irritating or cause allergic reactions in some people. So it's best to use it diluted, or better yet, look for pre-formulated products that contain it at an appropriate concentration.
Okay, what about coconut oil? That's popular.
Coconut oil is definitely moisturizing, which can feel good on a dry, itchy scalp, and it does contain lauric acid, which has some mild antifungal activity. But
There's a but.
there's a but. Remember, Malassezia yeast feeds on oils, specifically certain fatty acids found in oils. So while coconut oil might soothe, leaving it on the scalp, especially for extended periods, could potentially feed the yeast.
Oh, okay, so if you use it.
If you use it, perhaps as a pre-shampoo treatment for scaling, make sure you wash it out thoroughly with a proper shampoo afterward. Don't just leave it sitting there.
Good point, aloe vera.
Aloe vera gel is generally well regarded for its soothing, anti-inflammatory, and moisturizing properties. It can definitely help calm itching and irritation, which is a common symptom. So as a soothing agent, it's probably fine and low risk.
Okay, those sound somewhat reasonable. What about the more controversial ones, apple cider vinegar?
ACV. Yes. The claims are often that it helps balance the scalp's pH or that its acidity inhibits yeast growth.
Does it?
Robust scientific evidence specifically for dandruff is really lacking. There isn't strong proof that significantly impacts Malassezia or the underlying inflammation in the way medicated ingredients do.
Yeah.
And there's a crucial precaution.
What's that?
It must be significantly diluted before applying it to the scalp. Pure or even lightly diluted ACV is quite acidic and can cause irritation or even chemical burns, especially on already inflamed skin. A 1.1 ratio with water is often suggested as a starting point, but even that could be too strong for some. Proceed with extreme caution, if at all.
Okay, warning noted. Baking soda. I've seen that recommended as a scrub.
Baking soda, sodium bicarbonate.
Yeah.
Yes, it acts as a physical exfoliant, kind of scrubbing away flakes. But another big but here.
Let me guess, it's risky.
It carries significant risks, yes. Baking soda is highly alkaline. Your scalp naturally has an acidic mantle, a slightly acidic pH which is protective. Using something highly alkaline like baking soda can disrupt that natural pH balance.
What was that view?
It can strip away protective oils, leading to dryness and irritation, and potentially even damage the hair shaft itself, making it brittle. So, while it might scrub off flakes temporarily, it could worsen the underlying scalp health. Definitely not recommended by dermatologists.
Okay, scratch baking soda off the list. What about crushing aspirin into shampoo?
Right. The idea there is that aspirin contains acetylsalicylic acid, which is related to salicylic acid, the keratolytic we talked about. So it's a DIY way to try and get that scale lifting effect.
Does it work?
It might have some mild exfoliating effect, but honestly, it's far more reliable, safer, and likely more effective to just use a commercially formulated shampoo that contains salicylic acid at the correct concentration and pH for scalp application. Trying to get the dose right by crushing tablets is guesswork and probably less effective.
So the bottom line on home remedies.
In essence, while some might provide temporary soothing or mild effects, they don't really address the complex underlying pathophysiology, the yeast, the inflammation, the cell turnover, with the targeted efficacy of proven medicated ingredients. Relying solely on them, especially for anything beyond very mild dandruff, is unlikely to provide adequate or lasting control, and some even carry risks.
That's a really clear takeaway. Okay, so we've covered treatments, lifestyle. When should you actually throw in the towel on self-treatment and seek professional care? What are the red flags?
Our sources give very clear indicators for when you, listening, should definitely consult a doctor, ideally a dermatologist. First, if you see no significant improvement after using those OTC medicated shampoos consistently and correctly, remember the contact time for a reasonable period, say 4 to 8 weeks.
Okay, if OTCs fail after a month or two, what else?
If your symptoms are severe right from the outset, we're talking intense, unbearable itching, significant redness and widespread inflammation, or painful sores or lesions on your scalp, don't wait. See a doctor.
Makes sense. Any other reasons?
Yes, if the condition is causing you significant emotional distress or affecting your quality of life, that's a perfectly valid reason to seek help. Also, if you see any signs of a secondary bacterial infection, things like oozing, significant crusting, increased pain or tenderness, that definitely needs medical attention.
Infection is serious.
Absolutely. And finally, if there's any diagnostic uncertainty, if you're just not sure if it is dandruff or SD, or if you suspect it might be psoriasis or something else, getting an accurate diagnosis from a professional is crucial before you proceed with treatment.
Okay, those are clear triggers. Now, who should you see? You mentioned dermatologist, but what about a trichologist? What's the difference?
That's a really good question, as the terms can be confusing. A dermatologist is a medical doctor, an MD or DO, who has completed specialized residency training in diagnosing and treating conditions of the skin, hair, and nails. They are qualified to diagnose the full range of conditions, differentiate between them, and prescribe the entire spectrum of medical treatments, including prescription medications and procedures.
Okay, so a fully qualified medical skin doctor. What about a trichologist?
A trichologist is a specialist who focuses specifically on the hair and scalp. However, the term trichologist itself is not as tightly regulated medically as dermatologist is. Meaning, some trichologists are board-certified dermatologists who have a particular interest and expertise in hair and scalp disorders. They're the most highly qualified. Others might have completed specific certification programs in trichology, which vary in depth and scope, but they may not be licensed medical doctors and therefore cannot prescribe prescription medications.
Okay, so there's a range.
Yes. So while a certified trichologist can be very knowledgeable about hair science, scalp health, and cosmetic treatments for diagnosing and managing a medical condition like seborrheic dermatitis, especially if prescription treatment might be needed, the general recommendation from our sources is to consult a board-certified dermatologist first. They have the full diagnostic and prescriptive authority.
That's a helpful distinction. Now, for people listening, maybe specifically in a place like Mumbai where some of our source material focused, navigating the provider landscape can be tricky. How do you find the right professional?
Yeah, the sources highlighted a good strategy, which is really applicable anywhere. It involves using multiple sources to vet potential providers. Don't just rely on one thing.
Like what?
Combine looking at official clinic websites to understand their services and the doctor's credentials with checking third-party review platforms, things like Practo, Just Dial, Google reviews to get a sense of patient experiences, and also try to verify their professional credentials if possible.
Okay, so triangulate the information. Our sources mentioned some specific clinics and doctors in Mumbai as examples.
Yes, they did, providing a good illustration of the different types of expertise available. For instance, Dr. Rinki Kapoor at the Aesthetic Clinics was highlighted. She's an internationally trained dermatologist, dermatosurgeon, cosmetic dermatologist with fellowships from places like Singapore and Stanford.
Wow, impressive credentials.
Very. She's even a co-inventor of a hair growth factor treatment called QR678. The patient feedback mentioned was overwhelmingly positive, especially for her expertise in complex cosmetic and medical cases, and her good patient rapport. So for someone maybe seeking really top-tier care, perhaps for stubborn or complex SD, possibly combined with other concerns, she represents that high-end expertise.
Okay, who else?
Then there was Dr. Manisha's Revive Clinic, led by Dr. Manisha Sini, described as a cosmetologist and trichologist. Her clinic offers a specific dandruff freedom program.
What does that involve?
It seems to integrate conventional treatments with more advanced therapies, sometimes found in cosmetic settings, like low-level laser therapy, photodynamic therapy, maybe oxygen infusion for the scalp. The patient reviews cited were strong, praising her diagnostic skills and empathetic care, particularly for hair fall and other cosmetic concerns alongside dandruff. She represents maybe a more holistic approach, integrating aesthetic technologies.
Interesting. And a pure trichology focus.
Right, Revital Trichology with Dr. Rekha Yadav was mentioned. She's a certified trichologist through the International Association of Trichologists in Australia, with reportedly over 20 years focused exclusively on hair and scalp disorders.
So deep focus there.
Yes, treating dandruff, SD, various types of hair loss, alopecia, and offering advanced treatments like PRF and GFC, which are often used for hair restoration. Patient feedback seemed generally positive regarding hair loss results and personal attention, though the sources did note some recurring comments about the cost or perhaps the use of proprietary clinic products. So, an option for someone specifically seeking that dedicated trichology perspective, maybe being mindful of potential costs.
Okay. And you mentioned using platforms like Practo.
Exactly. And there were others mentioned too, like Dr. Deepam J. Shah at Viva Aesthetic Clinic, highlighted as a highly rated dermatologist on Practo, specifically for dandruff treatment. The point is, these online platforms allow you, the user, to filter by location, check availability, read patient ratings and reviews. They're a great tool for shortlisting potential specialists in your area.
But then you still need to do your homework on the shortlisted ones.
Precisely. Use the platform to find options, then dig deeper into their credentials, clinic website, and maybe look for reviews on multiple platforms if possible. Triangulating that data gives you the most robust basis for making an informed choice that feels right for you.
Excellent advice. Okay, let's bring it all together now. We've covered the condition, the causes, the treatments, lifestyle factors, finding help. Let's synthesize all this into your personalized long-term management protocol, what our sources called the stepped care approach. This is the actionable plan you can start today.
Right. This is where the rubber meets the road. Step 1. Foundational care. Think of this as the first 4 weeks. 2 key parts here. First, immediately prioritize that lifestyle intervention. Start making conscious choices to reduce dietary sugar and refined carbs. Make an effort to increase those healthy omega-3 fats, zinc, and B vitamins through your diet. And crucially, implement a consistent stress management practice, whatever works for you. Exercise, mindfulness, better sleep hygiene. Start that now.
Okay, lifestyle first. And the second part of step 1.
Simultaneously, begin OTC therapy. Select one high-potency medicated shampoo to start.
Yep.
Based on effectiveness, starting with either ketoconazole 1% or selenium sulfide 1% is a strong choice. Use it consistently 2 to 3 times per week and really make sure you get that 5 to 10 minutes of contact time on the scalp before rinsing thoroughly. Maybe use a compatible anti-dandruff conditioner just on the ends of your hair or none at all initially to avoid washing away the active ingredient from your scalp.
Okay, step 1. Lifestyle changes plus 1 good OTC shampoo used correctly for 4 weeks. What's next?
Step 2. Optimization and rotation. This is for weeks 4 to 8. After those first 4 weeks of consistent effort, honestly assess your progress. How's your scalp looking and feeling? If you're seeing excellent results, the flakes are gone, itching is minimal, inflammation down, fantastic. Just keep doing what you're doing in step 1 as your maintenance.
But what if it's only partially better or it hasn't improved much?
Right. If you've plateaued or the improvement is incomplete after 4 weeks, now is the time to consider transitioning to that rotation strategy we discussed. Keep your primary antifungal shampoo, the ketoconazole or selenium sulfide, but add in a second shampoo with a different mechanism.
Like which one?
Good options would be a salicylic acid shampoo if you still have scaling you want to lift, or maybe a parathione zinc shampoo as a different type of antifungal antimicrobial agent. Then alternate between your 2 chosen shampoos with each wash. So maybe ketoconazole on Monday, salicylic acid on Thursday, for example.
Okay, so step 2 is either continue step 1 if it worked, or switch to rotating 2 different shampoos if it didn't fully work after 4 weeks. Then what?
Step 3. Professional consultation if necessary. You move to this step if your symptoms were very severe right from the start, or if there's still no significant improvement after 8 weeks of diligently following steps 1 and 2, giving the OTCs and rotation a fair shot. Or, of course, if you develop any irritation, signs of infection, or have that diagnostic uncertainty we talked about earlier.
And when you go to the doctor.
Be prepared to discuss your treatment history clearly. Tell them exactly which shampoos you've used, for how long, how often, and what the results were. That helps them immensely in deciding the next best step for you, which will likely involve those prescription options.
Okay. And assuming prescriptions are needed. Step 4.
Step 4 is adherence to a professional maintenance plan. If prescription therapy, stronger shampoos, topical steroids, maybe even pills are needed to get your symptoms under control initially, it's crucial to work closely with your dermatologist and use them exactly as directed. Don't stop them prematurely just because things look better.
Right. Finish the course or follow the instructions.
Exactly. Then, once your symptoms are clearly in remission, work with your dermatologist to establish a long-term maintenance plan. This typically involves gradually reducing the frequency of the prescription products, tapering them, and then using an effective medicated shampoo, which might be one of stronger prescription ones used less often. Or maybe stepping back down to a potent OTC one, maybe just 1 or 2 times per week. Indefinite. Yes, indefinitely, to prevent those relapses. Remember the management mindset. This isn't about curing it and stopping. It's about finding the minimum effective treatment needed to keep it under control long term.
That makes so much sense laid out like that.
So putting it all together, while that permanent cure for the underlying predisposition isn't currently possible, a state of permanent control over dandruff and seborrheic dermatitis is absolutely a highly realistic and achievable objective for most people.
How?
By truly understanding its chronic inflammatory nature, by adopting that proactive long-term management mindset, and by following a logical evidence-based treatment hierarchy, like the stepped care approach we just outlined, you really can get on top of it.
That's incredibly empowering. Okay, a final thought to leave our listeners with. Consider how this deep dive into something as common as dandruff actually reveals a profound truth about our bodies. Achieving control often comes not from battling an enemy, but from understanding and gently managing the delicate ecosystems within and upon us. How might this perspective change the way you approach other chronic health challenges or just aspects of well-being in your life?
That's a great point. It shifts from fighting to balancing.
Exactly. We really encourage you to embrace this management mindset, take these proactive steps we've discussed, and work towards achieving that comfortable, healthy scalp you deserve.